I recently had stem cell injection in my right wrist. I had severe arthritis in my wrist. I've gone to my doctor and he suggested a PRC, a proximal rollcapectomy, which would be removing 3 bones from my wrist. And the results of that would be limited motion in my wrist. I'm a service technician. I work with my hands. They're kind of important to me to make my living. Upon coming here, I had this much, as far back as I could move my hand. Now, I get that much more motion. It's been 9 weeks.
Before you had the injection, you had no extension, no ability to move your wrist backwards, is what you're saying.
This is far back as it would go. I couldn't go that far back.
And that was really inhibiting your ability to do your job as a mechanic?
Yes.
Okay.
Like that. I still feel in a lot of pain. Things are moving along as far as more motion and be able to do more things. I can throw the frisbee for my dog, which makes my dog happy.
So you weren't able to do that activity before,
yes,
correct?
Very painful. The flick of the wrist.
Oh, okay. It was getting worse?
Yeah, it was getting worse.
Okay. Yeah. All right, so when we did the injection, it was 9 weeks ago. It was an allograft injection which contained stem cells.
Yeah, it's very minimal and doesn't feel like anything at all.
Okay.
Just 2 little shots at that, and I'm getting the electropulse therapy.
Okay, we're doing the follow-up visits with you two to nurture that injection. How long did it take before you started to notice a difference within the wrist?
4 or 5 weeks.
Took about 4 or 5 weeks.
Yes.
And so the pain started to decrease and you started to notice some improved mobility, range of motion.
Yes, more improved mobility, and I still have a lot of pain. I can do more, maybe that's why I'm feeling with pain too, because I can do more now than I could before.
Mm-hmm.
I know it takes about approximately a year, and we'll see how it progresses from there.
Would you recommend this for anybody?
Oh yes, I recommend this. If I did have the proximal rollcapectomy, I would have been out a minimum of 10 weeks of work. I was out of work for this for 2 weeks, whereas I use my hands a lot. So for other people who don't really have a lot of hand usage in their work, they could probably be back in about a week. So we're talking 10 weeks without pay, compared to 2 weeks vacation time. Mm-hmm. So that was a big savings right there.
And you were saying if you had that procedure done, the chances of you able to return to your job would have been
yes, I would have the flexibility in my hand.